everybody look right here for one of them, all right? Good, one more, hold it.
Whoop, whoop, whoop.
Oh, there it goes, go. All right, go ahead.
Our greatest concern is how do you fit senior care into emergency medicine?
Each time a senior needs health care, many of them start off in the emergency room.
And what we're attempting to do in this emergency room is change all that.
When Holy Cross Hospital first approached me about partnering with the Erickson School to develop the nation's first senior-specific emergency center, I jumped at the chance. As a physician, I started my career in emergency medicine before moving on to geriatrics, and this project gave me a chance to bring together two of my great loves in the field of medicine. And even better, I got to pull on all of the resources of the Erickson School in management and policy and organizational development, and now, after a year of hard work, they're getting ready to open.
My name is Bonnie Mann, and I'm the Senior Director of the Office of Seniors here at Holy Cross Hospital. This project affords Holy Cross the opportunity to apply best practice to the care delivery for our elderly.
We are going to go through a change in the next 10 years with respect to the aging of the population that may even be more dramatic. Right now, only 1 out of every 8 people who live in Montgomery County are over 65. But almost 1 out of every 2 people who will be added to the population in the next 10 years are going to be over 65. And because of the healthcare needs of the people over 65, their needs are going to be dramatic.
What you see here today really is a combination of all the efforts that we've done over the last year and a half to look at how we can provide better care for seniors.
All right, go ahead.
We became convinced at Holy Cross that this wasn't the best way to deliver care in a big emergency room with all of the noise and all of the bustle going on. So we've worked together with the Erickson School to design a seniors emergency room, one just for people who need special attention and special care. So we've tried to look at everything from the environment, making it quieter, making it more soothing, to things as simple as mattresses and televisions and the like, so that when seniors are here, they're in a more relaxed state. Care of seniors in EDs is not our shining moment in healthcare, and my hope is that we can make a small contribution toward making it better.
The American healthcare system is going to be seeing tremendous transformational changes over the next 10, 15 years. And much of it's going to be driven by a shift from an acute care focus into a senior care focus, just based on our changes in population. And this emergency department, this new emergency center for seniors, I think is the very first example of a healthcare system recalibrating and redesigning its environments and its services to meet the needs of older people specifically.
+% of medications that we nice big blanket warmer, so when we do get our patients their comfort carrying measures and their pillows and their blankets, that they're going to get a warm blanket, because sometimes a warm blanket goes further than a dose of antibiotics and making the person feel comfortable.
And if you come into the room, I think it helps to get the patient's perspective.
We couldn't walk into this environment and not be struck by how calming the actual physical environment really is. We worked very hard to create that through the choice of the colors on the wall that was specifically chosen for its soothing effect and its calming tone effect. We chose lighting that would support that as well.
Come in here and you're lying here, you can turn the light down for number one, so you don't have those. When you look up, you can see the clock, so you can keep track of time, because when you're here, 5 minutes is like 5 hours.
Another very attractive and functional feature is the floor. This is not an institutional high polish. There is no glare, which really facilitates the ability to ambulate. It looks much more like one's home.
In those other rooms, you notice there's a lot of equipment that kind of took up part of the space, a big C locker, bigger monitors on the wall. All of our monitoring will be done via wireless monitoring. They'll be wearing a little pack that actually goes to a monitor that's within the nurse.
The conventional hospital emergency department really focuses around high technology acute interventions and often doesn't pay as much attention to the needs of people who arrive with, say, multiple chronic illnesses. And yet that's the reality for many older people who need emergency services. And what's different here, and what I think they've done a really good job with here at Holy Cross, is thinking about the specific needs of seniors, and they're adapting high-quality emergency room care so that it meets the needs of older people specifically. That's the innovation, that's what's new.